We often think hair loss is, well, mainly a male issue, don't we?
Yeah, that's the common perception.
But for so many women, seeing more hair in the brush or noticing thinner spots, it can be really distressing. It hits your confidence.
Absolutely. It's incredibly personal, and the numbers show it's common. A lot of women deal with noticeable hair loss sometime in their lives.
Which is why we wanted to dive into this. We've got this article here that really lays out the top 10 reasons why women experience hair loss.
Exactly. Goes into the common causes and, importantly, how you might identify them.
So our mission today really is to unpack that. We want to give you, our listener, a clearer picture of what might be going on without it feeling, too overwhelming or technical.
Sounds good. Clarity is key here.
Okay, let's jump in. First up, a really big one. Hormones.
Hormones are definitely a major player. And what's interesting is how shifts during different life stages really impact hair, like pregnancy, for example.
Oh, yeah, the pregnancy hair glow. Suddenly you have this amazing thick hair.
That's that estrogen surge doing its work. But then after the baby arrives,
the fallout begins, literally.
Right. Estrogen levels drop quite sharply, and that pushes a lot of hair follicles into the shedding phase all at once. It's called telogen effluvium.
Telogen effluvium.
And it usually shows up a few months postpartum. It can look scary seeing all that hair fall out.
I bet. But it's usually temporary.
Yes, that's the crucial part. It's typically temporary as your hormones settle back down.
That's reassuring. Okay, what about later in life? Menopause.
Another big hormonal shift. During menopause, estrogen and progesterone levels decline.
And that affects hair.
It can. Hair follicles might become more sensitive to androgens, male hormones that women have in small amounts too.
And that sensitivity causes thinning.
Exactly. It can cause the follicles to shrink, producing finer, thinner hairs.
And aren't there conditions like PCOS too? Polycystic ovary syndrome?
Yes, absolutely. PCOS often involves higher levels of androgens, which can definitely contribute to hair thinning, often noticeable right around the crown area.
So if someone's wondering, is this hormonal? What are the signs?
Well, look for sudden thinning or shedding, especially if it lines up with pregnancy, postpartum, or the start of menopause.
Okay.
Thinning that's kind of focused on the crown or temples can also be a clue. And, if you have other signs of hormonal imbalance, like irregular periods or maybe unexplained weight changes with PCOS, that points towards hormones too.
Makes sense. And what about addressing it? What does the article suggest?
It mentions things like hormonal therapies, sometimes birth control pills, and certain medications called anti-androgens like spironolactone.
Right.
And for menopause-related thinning, hormone replacement therapy, HRT, might be an option, but really, this is something you absolutely need to discuss with a doctor.
Definitely. A proper diagnosis is key. Okay, let's shift gears. What about genetics?
Ah, yes. Good old family history, female pattern baldness, or androgenetic alopecia.
Sounds serious. Is it common?
It's the hereditary type of hair thinning. And yeah, it's pretty common. It often starts becoming noticeable around age 40, maybe even earlier for some.
How is it different from male pattern baldness?
It usually looks different. Women tend to see more diffuse thinning, like all across the scalp.
So not the receding hairline or the bald spot on top?
Generally, no. It's more like the part widens or you just notice less volume overall, especially maybe at the crown.
And the main clue is?
A family history. If your mom, dad, aunts, uncles had hair thinning, that's a big indicator. And it's usually gradual, happening over time, not like a sudden shedding phase.
Okay, gradual thinning, family history. What can be done about it?
Well, the article points to minoxidil, that's Rogaine. It's the only topical treatment the FDA has approved specifically for female pattern hair loss.
Does it work?
It can help stimulate regrowth and slow down the thinning process for many women. And sometimes those hormonal therapies we mentioned, like spironolactone, might also be used.
Got it. Okay, next up, something we all experience, stress.
Oh, definitely. Stress impacts so much, including our hair.
How does that work? Is it the same mechanism as the postpartum shedding?
It's very similar. Major stress, whether it's emotional trauma, a serious illness, even surgery, can trigger that same telogen effluvium.
So a shock to the system pushes hair into the shedding phase.
Exactly. A larger number of hairs than usual enter that resting phase, and then a few months down the line, they shed.
A few months later. So it's a delayed reaction again.
Precisely. You might have a really stressful period, and then 2 or 3 months later, you notice you're shedding way more hair than normal.
And it's usually all over thinning.
Yes, typically diffuse thinning across the whole scalp. So if you can pinpoint a significant stressful event before the shedding started, that's a pretty strong clue.
And what helps? Besides waving a magic wand to get rid of stress.
Ah, if only.
Yeah.
But seriously, stress management techniques are key. Things like yoga, meditation, deep breathing exercises, they can genuinely help.
Finding ways to cope.
Exactly. And if the stress is ongoing or really overwhelming, talking to a therapist or counselor can make a huge difference. Often, as the stress reduces, the hair shedding cycle normalizes.
That makes sense. Our bodies really do keep score. Okay, let's talk about fuel, nutrition.
Yes. What we eat or don't eat plays a massive role in hair health. Deficiencies in key nutrients are a common cause of thinning.
Like which ones?
The big ones mentioned are iron, vitamin D, biotin, and zinc. Even if you're just a little low, it can sometimes affect your hair.
Iron deficiency, I know that's pretty common in women, right?
Very common, especially before menopause. Iron is crucial for healthy hair follicles. Low iron can lead to weaker, brittle hair and more shedding.
Okay. And vitamin D.
Vitamin B is involved in the hair growth cycle itself. Studies have linked low vitamin D to conditions like alopecia areata and that telogen effluvium we keep mentioning.
Right. And biotin and zinc.
Both are super important for hair structure and strength. Not getting enough can cause thinning, shedding, and general weakness in the hair.
So how would you know if nutrition is the issue?
Again, look for that diffuse shedding pattern. Sometimes it comes on relatively quickly. And you might have other symptoms too.
Like what?
Like fatigue if you're low on iron, maybe muscle aches with low vitamin D, or brittle nails and dry skin could point to biotin or zinc issues. And of course, if you know your diet isn't great or is very restricted.
And the fix. Just pop a multivitamin.
Well, blood tests are really the best way to know for sure what you're deficient in. Then you can supplement specifically.
Targeted supplements.
Yes. But ideally, you want to get these nutrients from a balanced diet first. Whole foods are always the best foundation.
Good advice. Okay, next cause involves a little gland in the neck. The thyroid.
The thyroid, yes. It regulates so much in our bodies, including hair growth.
So problems there can cause hair loss.
Definitely. Both an underactive thyroid, hypothyroidism, and an overactive one, hyperthyroidism, can disrupt the hair follicle cycle and lead to significant hair loss.
How would someone spot that? Is it just the hair thinning?
The thinning is common, often on the top and sides of the scalp, but usually there are other telltale thyroid symptoms.
That's just.
With hypo or underactive, think fatigue, weight gain, feeling cold all the time. With hyper or overactive, maybe anxiety, weight loss, irritability, feeling hot.
Okay, so it's the whole picture.
Exactly.
Yeah.
If hair loss starts somewhat suddenly and you have some of these other symptoms, it's worth checking your thyroid function.
And if it is the thyroid?
The good news is that treating the underlying thyroid condition usually helps the hair. Hormone replacement for hypo, medications to regulate for hyper. Once levels normalize, hair often starts to regrow.
That's encouraging. All right, what about medications, things we take for other health issues?
Yes, that's number 6 on the list. Some medications can, unfortunately, have hair loss as a side effect.
It seems counterintuitive, taking something for health that then causes another issue.
It can be frustrating. Chemotherapy is the most well-known example, obviously.
Right.
But others include certain blood thinners like warfarin, some antidepressants, and beta blockers used for high blood pressure. It's not everyone who takes them, but it happens.
How do you connect the dots if you start a new med and then notice thinning?
Timing is often key. If hair loss starts, say, a month or 2 or 3 after starting a new medication, it's definitely suspect.
Okay.
The loss could be patchy or diffuse, and sometimes it might take a few months to become really noticeable, which can make it harder to link.
So what should you do if you think a medication is the culprit?
Talk to your doctor. Definitely don't just stop taking a prescribed medication on your own.
Right. Crucial point.
Your doctor won't be able to switch you to an alternative medication with less risk of hair loss, or perhaps adjust the dosage. Sometimes if medication can be stopped safely, the hair might regrow, but always under medical guidance.
Makes sense. Always talk to your doctor. Okay, number 7, alopecia areata.
Right, this one is different. It's an autoimmune condition.
Autoimmune, meaning the body attacks itself.
Exactly. In alopecia areata, the immune system mistakenly attacks the hair follicles.
And what does that look like?
It typically causes sudden, well-defined patches of hair loss, often round or oval, and the skin underneath looks smooth and normal.
Just on the scalp.
Mostly scalp, but it can affect eyebrows, eyelashes, other body hair too. It can happen at any age, to anyone.
Any connection to other conditions?
Sometimes it can occur alongside other autoimmune disorders, like thyroid disease, for instance.
Interesting link. And treatment.
Often involves trying to calm down that immune response locally. Corticosteroid injections into the patches are common. Topical steroids. Sometimes other treatments like topical immunotherapy might be used depending on the severity.
Okay. Now for something quite different again. Trichotillomania.
Yes. Number 8. This isn't a physical illness in the same way. It's a psychological disorder.
The hair pulling disorder.
Correct. It involves a recurrent, irresistible urge to pull out one's own hair, scalp, eyebrows, eyelashes.
And that repetitive pulling obviously leads to hair loss.
Yes, significant hair loss in the areas where the pulling occurs.
What are the signs to look for besides the missing hair?
The patches of hair loss are often irregular, maybe in easy-to-reach spots. You might see broken hairs of different lengths within the patch, and often there's an underlying anxiety or stress component associated with the pulling behavior.
And how is this addressed?
Therapy is key. Specifically, behavioral therapies like cognitive behavioral therapy or CBT can be very effective in managing the urges. Sometimes medication for anxiety or compulsive behaviors might help too. Professional support is really important here.
Absolutely. Okay, number 9 is something many of us probably do. Excessive styling.
Guilty as charged sometimes. Yes, how we treat our hair matters.
So heat tools, chemicals, tight hairstyles.
All of the above. Constant high heat from flat irons or curling wands, chemical treatments like bleach, dyes, perms, relaxers, and even hairstyles that pull really tight, like high ponytails or tight braids worn constantly.
How does that cause loss? Is it damaging the follicle?
It's usually more about damaging the hair shaft itself. It causes breakage.
Ah, so the hair is snapping off, not falling from the root.
Exactly. The hair becomes weak, brittle, prone to snapping. You might notice lots of split ends or see breakage closer to the roots where the tension from tight styles is highest. Your hair just feels dry and damaged.
And the scalp might look thinner because so many strands are broken off.
Precisely. If you're a heavy user of heat, chemicals, or tight styles, and you notice this kind of breakage and thinning, that's likely a big factor.
So the solution is, be kinder to our hair.
Pretty much. Cut back on the heat styling, maybe explore heat protectants if you do use heat. Give your hair breaks from chemical treatments. Opt for looser hairstyles that don't put constant tension on the roots.
And maybe some TLC.
Definitely. Using deep conditioning treatments or hair masks regularly can help restore moisture and improve resilience.
Makes sense. Okay, finally number 10. Scalp issues.
Right. Sometimes the problem isn't the hair itself initially, but the environment it's growing in the scalp.
Like infections.
Yes, things like fungal infections, ringworm is a classic example, or inflammatory conditions like seborrheic dermatitis, which is like severe dandruff, or psoriasis on the scalp.
And these conditions interfere with hair growth.
They can. They cause inflammation, scaling, itching, sometimes damage the hair follicles directly, and all of that can lead to increased shedding or patchy hair loss in the affected areas.
What should you look out for?
An itchy, red, inflamed, or scaly scalp is a big sign. Maybe noticeable flakes, dandruff, sores, or just patchy loss in specific areas where the scalp feels irritated.
And treatment depends on the cause.
Absolutely. Antifungal treatments for ringworm, medicated shampoos, or topical steroids for seborrheic dermatitis or psoriasis. Getting the right diagnosis is key.
And acting quickly.
Yes, because chronic inflammation or untreated infections can potentially lead to more permanent follicle damage in some cases. So early intervention is really beneficial.
Wow, okay, that's a comprehensive list. 10 different potential causes.
It really covers a lot of ground, doesn't it? From internal factors like hormones and genetics to external things like stress and styling.
It really highlights that female hair loss isn't just one thing. It's complex.
It absolutely is. And hopefully, breaking down these top 10 causes gives a better framework for understanding what might be going on.
So for anyone listening who's experiencing this, the main takeaway is...
Well, first, know that it's common and you're not alone. Second, this deep dive hopefully gives you some potential avenues to consider based on your specific symptoms and history.
Yeah, maybe something we discussed today resonated, like, oh, that sounds like what I'm seeing.
Exactly. But, and this is the most important point, while this information is a great starting point, self-diagnosing can be tricky.
Right.
For a proper diagnosis and a treatment plan tailored to you, you really need to see a healthcare provider, like a doctor or a dermatologist.
They can do the right tests, figure out the underlying cause, and recommend the best approach. And often, the sooner you address it, the better the outcome.
Couldn't agree more. Early and accurate diagnosis is key.
So we've covered hormones, genetics, stress, nutrition, thyroid, meds, autoimmune issues, pulling, styling, scalp conditions. It really shows how interconnected everything is for hair health,
It really does.
which leads to a final thought. Considering this intricate interplay of internal health and external factors on our hair, what other aspects of our modern lifestyles, maybe things we haven't even touched on today, might be subtly influencing these hair loss trends in ways we're only just beginning to understand?
That's a fascinating question to ponder, something definitely worth thinking about.